Welcome everybody to our session number 4. And today we're going to talk about nutrition, circulation, and breathing. As usual, I'm going to share with you the presentation and disclaimer that we're not treating anything and it's not a professional advice. All right. So far, we've been learning about practices, relaxation practices, and also about central clarity, how to use your periphery, and the importance of central vision, right? And we were talking about the parent movement, palming, and breathing. We'll be talking about it today again, but very important topic is eye nutrition, circulation, and movement, and they're all connected, of course. So unfortunately, in medical school, we had very short course on nutrition. So I actually started studying nutrition by myself, and I got certified as a nutrition consultant. So it is well known, and multiple studies show the importance of various vitamins and minerals for eyesight, for eye health, and especially potent antioxidants, lutein and zeaxanthin. And these antioxidants in particular, they have a protective property for our eyesight. They actually even reduce the risk of progression of some chronic eye diseases. All right, so just on this slide, you see again the retina, the enlarged version of the retina. And in the macula, in the central part of the retina, which is responsible for central and clear vision, that's where lutein and zeaxanthin accumulate. And that's why they're so important for our eye health. They actually protect our eyes from blue light as well. So we have the natural protection from blue light, and because they absorb these harmful rays of the blue light, and they retain pigment epithelium in a proper manner and in a healthy state. And as I mentioned, they even reduce and irreversible blindness and very serious conditions in elderly people. All right, so where do we get lutein and zeaxanthin? This is the class of antioxidant they call xanthophyll carotenoids, right? And you probably all heard about carotenoids. And they are widely found in a variety of fruit and vegetables. And especially, we know about carrots, right? But especially the highest amount of these antioxidants are in leafy green vegetables, in particular, like kale. There are other antioxidants that are very important for the eyesight and eye health. These are anthocyanins. They're called anthocyanins, and they are found in purple bilberries or wild blueberries. But so there are many supplements, isolated supplement out there on the market of these particular antioxidants, lutein, zeaxanthin, or also anthocyanins. But the studies show, until it's proven, these nutrients these nutrients are better consumed in a natural state. And this is because in nature, it is meant to be consumed in a natural state, right? So if we isolate certain nutrient or supplements, it's not necessarily could be beneficial. So this is one of the studies that shows this. All right. And you see the amount of antioxidants. This is particularly the lutein and zeaxanthin. You see the biggest amount of it in kale, right? And of course, carrots have these carotenoids, but it's much lower contents in a cup of these in baby carrots. So it's amount in the cup. All right. So you see the variety of fresh fruit and vegetables that they can be found. All right. Talking about the diet, right? So again, going back to this topic of the isolated supplements or nutrients or multivitamins, and you see if we compare the multivitamins and the whole fruit like apple and pill, you see the amount of vitamins, minerals that the multivitamin has on the left, and the biggest, like up to 10,000 phytonutrients that the whole food has, right? So it's better to eat, of course, consume the whole food. All right. There is a place for certain supplements. You have to be very careful with supplements. So I personally, from my experience, I personally found this whole food supplements around the COVID times in 2020. It's called Juice Plus, and it's powdered fruit, vegetables, greens, and omega-3, natural omega-3s. They have the highest amount, concentrated amount of whole food just in powdered form. So this is not a substitute for the fruit and vegetables, because it's better to consume it in the whole food state, but it could be a good bridge from the bad, sad diet to the healthful diet. And it actually causes the change of your metabolism, and your taste buds change when you start consuming it. And I've seen it in my own family, in the clients and patients. So if you're wondering what supplements, this is a whole food practically supplements that I think it's very safe to consume if you want to increase your eye health and just overall health. All right. And they actually, again, this is like just 30 whole foods in these supplements in powdered form. Okay. So common eye conditions, just to remind you. So in high income countries, they're mostly refractive errors, or like myopia, hypermyopia, right? Followed by macular degeneration, cataract, glaucoma. In the middle, low-income countries, cataract is in the first place, and then AMD and glaucoma. And then the rest of the very common eye conditions: myopia, hypermyopia, right? Astigmatism, dry eye syndrome, strabismus of crossed eyes, cataracts. So why I'm talking about these statistics, I just want to show you how nutrition affects these conditions. Okay, so if we take diabetes, diabetic retinopathy is so common. over 30 million people in the US have diabetes, and they have increased risk of vision loss and blindness because of diabetic retinopathy, because all vessels are damaged all over the body in diabetic person, right? So most common eye, it is the most common eye condition in diabetics. And also along with macular edema, cataract, there is a higher risk of cataract, developing cataract and glaucoma. So the longer a person has diabetes, of course, the greater their risk of losing eyesight. Of course, is if it's additional, the heart disease, high blood pressure, high cholesterol, it increases risk even more of losing the eyesight. So all eye doctors usually check for looking inside your eye, check for the changes in the vessels on the retina during dilated exam. So it could be diagnosed, and it's clearly can be seen. All right, that's how it looks. So this is the normal retina on the left and the diabetic retina, and you see the blotches of blood and the thinned retina, the damaged retina, and the vessels. This is obvious. All right. There are treatment, of course. Diabetic retinopathy can be treated, and the National Eye Institute developed this method, and injections of antivascular endothelin growth factor can be used in acute stages. Corticosteroids, also laser treatment can be used, and even eye surgery, because the blood, the vessels, when damaged vessels burst and there is hemorrhage, blood, like pieces of blood should be removed from vitreous body, like which is inside the eye. Okay, so managing diabetes. How do we manage diabetes? With of course, diet, exercise, and medication if necessary, right? It's the best way for people with diabetes to lower risk of vision loss. Okay, hypertension or heart disease one of the symptoms of heart disease, there is a high blood pressure or hypertension. And these are the changes and the complications of the high blood pressure. Usually ophthalmologists will see the signs of hypertension if they look at the vessels in your eye. And again, in a really advanced disease, it can be seen the changes in the retina. That's how they look. Okay. So, and of course, it can be complicated if diabetes and hypertension is also coexist. And it can cause the irreversible visual loss, of course. So most changes will improve within 6 months if it's like a first accident of the hemorrhage, but over time it does damage the retina. Okay, so if we look at the human circulation, it is critical for it's very critical in nutrition. If we have healthy nutrition, our body stays healthy, it improves circulation, it normalizes everything, right? So impaired circulation at any it can cause dysfunction of any organ of the body, right? Because we have vessels. Cardiovascular system supplies the whole body. So it supplies blood to the heart, to the lungs, brain, right? If it's a brain, it's a stroke, it's a heart attack, right? Internal organs and even back pain can be the symptoms of the heart disease. So healthy cardiovascular system equals healthy body. And what is good for your heart is also good for your eyes, right? It's a healthy nutrition, and studies show that predominantly whole food plant-based diet is the best. Okay. And of course, impaired supply to the eye causes all these diseases, including cataract and refractive errors. If the poor supplies to the muscles, eye muscles don't work well, so it causes all these eye problems. So if we look at the people in blue zones, they rarely actually wear glasses. And I can remind you, what are the blue zones? These are 5 places in the world where people live the longest. And these are in Okinawa, Japan, Sardinia, Italy, Icaria, Greece, Nicoya Peninsula in Costa Rica, and Loma Linda in California. So life expectancy there between 90 and 100 years. These people live in the communities. They have connection. They eat predominantly whole food plant-based diet. They do eat some animal food, but not as often. Maybe 1 to 3 times per month on a big feast. So again, social connection and physical activity is essential. And they all share these nine rules. So blue zones were discovered by journalist Dan Buettner, and he wrote a book about blue zones. It's, if you probably heard about it, just look it up. It's very informative. All right. So we'll talk about breathing. As I mentioned today, breathing is, of course, connected with the circulation, with nutrition, everything. So Dr. Bates was saying that many patients with imperfect sight benefit by breathing. One of the best methods is to separate the teeth while keeping the lips closed and breathe deeply, as though one were yawning, and you can try it now. When done properly, one can feel the cold air as it passes through the nose and down the throat. This method of breathing secures a great amount of relaxation of the nose, throat, body generally, including eyes and ears. So breathing properly is essential for overall health, including of course, the eyes, right? The eyesight. And the quick reminder, how the breathing works, the breathing muscles. There are many breathing muscles, and the biggest breathing muscle, of course, the diaphragm, right? And inhalation and exhalation, that's how it happens. And there is another great book called Breath by James Nestor. You may have heard about it. So he researched this topic in depth, and he interviewed the best top specialists of breathing all over the world. And his conclusion was, from all these interviews, that nose breathing is the healthiest. It's actually the most physiological. And between 3, 8, and 12 breaths per minute through the nose, and exhale through the mouth, and maybe sometimes through the nose as well. There are certain techniques that you can look up he has many interviews he's given. So why is it important? How it explains? So actually, why is it important for the overall health, and why is it relaxing? Because autonomic nervous system, right? The inhale is controlled by sympathetic nervous system, which is responsible for fight or flight. The exhale is controlled by parasympathetic nervous system, which is responsible for rest and digest. So we need, for proper breathing, it's easier to concentrate on exhale, and inhale comes naturally. So if you just inhale naturally and exhale with a force, your inhale will follow and you'll feel it. How for me it's actually, it was easier to understand this, and I think James Nestor actually mentioned that, mentions it in his book. Okay. So breathing is circulation, how it works, right? There is exchange of oxygen in the lungs, and then oxygen is supplied the blood, and that's how our body gets the oxygenated blood all over to all the organs. Okay, so vision actually happens in the brain, and I mentioned it before that eyes are part of our brain, and you see it's connected, right? And the vision is 90% mental, the vision process, and only 10% physical. So only 10% the physical functional. So the brain cannot survive without oxygen beyond 4 to 6 minutes. You probably know that. So that's why the breathing and circulation, proper breathing and healthy circulation is essential for our vision. And how do we maintain this? By, of course, what helps the regular physical activities, the exercise, whatever you do, and mostly outside, that's probably the best. All right. So one last thing that I wanted to mention and remind you that hydration is, just to remind you about hydration, how it is important for everything, including our vision, right? Because up to 60% of human body is water. Brain and heart are composed actually of 73% of water. And as I mentioned, eyes are part of our brain. Lungs are about on 83%. So breathing, proper breathing with your inhaling through the nose. If you inhaling through the mouth, you lose a lot, you get dehydrated, you lose a lot of fluids. So the skin also 64%, muscles and kidneys 79%, and even bones have 31% of water. So if we're talking about the eye, so vitreous body, it's the viscous clear substance that fills the eyeball, is 98% of water and only 2% of sodium hyaluronate and collagen fibers. That's why it's viscous, right? So drinking minimum 8 to 10 glasses of water daily, just aim for that. And remember that feeling of thirst and hunger are often mistaken. And just try to remember to drink first before you eat, and check if it's a real hunger. So staying hydrated helps all systems, including flushing out the toxins, optimizes brain function, of course, and main eye function, vision. All right. So we will finish this session now, and I will see you at the next session. Thank you so much for watching. See you next time.